Part of me is Carolina blue, full of flavor and excitement, like a wild roller coaster on the loose. But at times, I'm mean, dark, lonely, black, mad at the world, like a lost dog in the desert. Yet they are both true, and they are both me.
Thank you for tuning in to the Talks We Never Had podcast, where we talk about topics related to mental health and health disparities. We are a group of NIH trainees who are passionate about health equity and health justice. We represent NHGRI, NIMHD, NIMH, and NICHD. My name is Jordan, and I am joined by Emily, Micah, Urmi, and Dimeshni. Today, we're going to be talking about changes in suicide trends in Black, Indigenous, and people of color youth. Emily, that was a really moving poem. Give our listeners some context. What's the story behind it?
Yeah, of course. So that poem was published in the New York Times article titled "Why Are More Black Kids Suicidal? A Search for Answers." And it was written by 15-year-old Torian Graves before he took his own life. All too often, we hear devastating stories of children and adolescents like Torian dying by suicide. It's deeply saddening to know young people feel this way and don't receive help before dying. As I read the article and others similar to it, I learned more about the disparities and the trends that exist in youth, adolescent, and young adult suicide, specifically among BIPOC individuals. It heightened my awareness on this topic, and I think we should all talk more about it.
Yes, Emily, you're right. BIPOC youth have been having increasing rates of suicidal thoughts and behaviors. For example, American Indian and Alaskan Native, as well as multiracial high school youth, are more likely to seriously think about attempting suicide and to attempt suicide as well. So about 29 to 35% report seriously thinking about suicide, and 13 to 26% report attempting suicide. This is a pretty stark contrast to 19% of youth in the US population overall seriously thinking about suicide and 9% reporting making an attempt. In addition, among Black and Asian or Pacific Islanders, there's been a 30% and 16% increase, respectively, in suicide rates seen between 2014 and 2019.
Wow, those are such drastically increasing rates. Why are we seeing these trends?
So that's a really good question. I think we should unpack the why behind these changes in suicide trends are occurring by first painting an environment picture. So let's look at the environment of young people in the age range of 10 to 25, because data shows that inaccessibility of high quality mental health care services contribute to the mental health burden that BIPOC people experience as a whole. But what we can conclude is that a lot of this is rooted in access issues. So if we look at income inequality, the median household income across all races and ethnicities in the US for 2020 was $67,521. For Asian households, the median was $94,903. And for non-Hispanic whites, it was $74,912. So those two groups tend to be above the median. But if we're looking at Hispanics of any race, it drops below the median. So their income was $55,321 for 2020. And for American Indian and Alaska Natives in 2019, it was around $49,906, which is far below the median. And then for Black people in the United States, it was $45,870. So essentially, households headed by people who identify as Black or Hispanic or Indigenous have median incomes that are lower than the national median. And we know that the job and income loss due to COVID-19 has contributed to those numbers. In 2019, the supplemental poverty measure showed that BIPOC families are the most likely to experience financial vulnerability and live below the federal poverty line. And we know that therapeutic services are expensive. So if you're raising a family, or even if you're under the age of 26 and you're navigating young adulthood, if you're living at or below the poverty line and you have living expenses prioritized, how can you afford mental health interventions like psychotherapy for your kids or even yourself? I know from personal experience that if I didn't have employee benefits through insurance, NIH, I wouldn't be able to afford consistent therapy. So we see in our nation that oftentimes the nature of your access is connected to employment. And prior to the Affordable Care Act, people of color were more likely to be uninsured than non-Hispanic white people. And then post-ACA, Medicaid has been able to fill in some of those gaps with coverage, but the disparities with insurance coverage still persist. And today, Medicaid does cover some mental health interventions, but it's dependent on geography. So where you live and what your state has done to expand Medicaid is going to matter. And even the access issues with the demographic makeup of mental health professionals in the US, that affects, BIPOC youth, access to providers who are potentially more culturally sensitive, able to help with navigating language barriers and so forth. What we're seeing is that the mental health services and access to diversity in providers, which are necessities, are really being regarded as luxuries. And so BIPOC youth are dealing with the emotional and mental piece with systemic racism and the public health crisis of COVID. And so we're in a system that has failed to meet the needs of the most vulnerable.
I think those were all really great points that you raised, Jordan. And some other things that have been found to contribute to these trends include access to firearms, as well as cultural and structural stigma. So some research points to there being higher rates of Black youth mortality due to firearms compared to other racial and ethnic groups. And as you mentioned, Jordan, BIPOC individuals are less likely to receive mental health treatment, and their rates of engagement and completion tend to be much lower. So when they do seek services, they tend to experience higher chances of being misdiagnosed, assigned to junior professionals, and terminated from treatment prematurely. Another thing you mentioned was there being language barriers to care. And I think in addition to that, in some cultures, there's also a reluctance to acknowledge symptoms. So for example, among Asian American communities, there's shame that comes with having a mental illness. And this has resulted in Asian Americans being 3 times less likely to seek treatment or help compared to other racial groups in the US.
Those are all such great factors that you all listed. And I think it's important to consider that all those factors are compounded by the experiences of de facto segregation and racial discrimination, which can serve as chronic stressors in the lives of BIPOC youth and adolescents. And many studies to date have already linked perceived discrimination to an increased risk of mental health issues. But going beyond this, I'm curious, what does psychological research state on suicide within BIPOC youth communities?
Yeah, that's a great question. So to summarize, a review from 2021 from the University of California, San Diego summarizes that the current mental health system is not adequate enough to meet the unique worsening symptoms of BIPOC youth. And the authors also emphasize that medication is not and should not be the primary solution. And in fact, it can lead to overprescribing of meds for BIPOC youth. In a more recent review from this year from the University of Florida, further emphasizes the involvement of minority populations in care for BIPOC youth, especially about suicide. So researchers should closely work in tandem with the communities that they're trying to study.
So what are some changes or solutions we can push towards to help address suicide among BIPOC youth? Does anyone have any ideas?
So I feel like for like the community level, I think that we can have more culturally relevant prevention, intervention programs for for the different racial and ethnic groups. And also I think that we should invest more into the established community groups that's already addressing these issues. Like for example, like for me, I'm from Chicago, and there's a program that's on the west side that intervene for children who experience mental health, called Bill, that it helps them out with their mental health problems. And also I feel like for a policy level, I think that we need to implement mental health screening, and when we go see a primary care physician, and also just overall just make mental health resources more affordable, and like also have more initiative that can diversify the mental health healthcare team, because the majority of the workers doesn't reflect the population that they're treating. Like for example, there's a program that's run by APA that's to help increase more Black psychiatrists. So we need more programs like that. And overall, just addressing racism. I think racism is one of the contributing factors to for racial minorities for their mental health.
Yeah, those are all really good points. I like how, you talked about some of the things that we can do in the now, like raising awareness about what resources are already out there, but also, making sure that we have a helicopter view of what changes we want to see in the long term too. So we want to say thank you for tuning into the Talks We Never Had, and remember that every change starts with a conversation. So we hope that this podcast can inspire you all to engage in these types of talks with the people around you. So thank you for listening.